Joe Zarzaur and Dr. Malone here with another segment on Zarzaur Law TV. Dr. Malone had brought up to me not too long ago the fact that if you're rushed to the hospital these days in the emergency department there now, I think the standard of care is including a high dose of statin drugs in addition to an aspirin. And Dr. Malone was going to talk to us a little bit about that. So what is the basis for that? And first of all, start with what is a statin? And
okay.
So,
well, generally speaking, when someone goes into the ER complaining of chest pain, the first thing everybody hears about is, oh, did you take an aspirin yet? If not, here's one to take right now, as long as there's not some obvious contraindication. Well, there's recommendations that when you come in, if you have what they call acute coronary syndrome as the cause of your chest pain, to also get a high dose of a statin. A statin is more popularly known as these cholesterol-lowering drugs that people take. Zocor, Lipitor, Crestor, just to name a few. And it's got a little bit of a negative connotation because everybody says, oh, they're bad for you for whatever the case may be. And some people cannot tolerate them, which that's agreed upon, where they have liver dysfunction because of it. They have some muscle breakdown issues with it, where they get muscle aches and cramping, and those people can't tolerate the statin. That's fine. But taking a high-dose statin or being offered one in an emergency setting when you have ACS, the acute coronary syndrome, can have an effect on your coronary arteries to the point where it has nothing to do with lowering your cholesterol. It actually stabilizes the plaque that is in that artery that has ruptured, is causing inflammation, is having some oxidative effect on that part of the body, making your heart attack actually worse. The snowball is getting larger. So it can decrease that inflammation and stabilize the issue.
Compare the dose that they would give in a person with a heart attack issue in the ER versus what somebody takes at home.
Well, what someone takes at home is variable upon what their cholesterol levels are and what they can tolerate. And the doses vary between the agent, but to put in perspective, if it's between 20 milligrams and up to 80 milligrams, which is one of the doses, you might take 20 milligrams at home on a daily basis for years on end. High dose would be considered 80 milligrams.
Gotcha.
Or there's some where there's 10 milligrams and the high dose is considered 40. So again, it's one of those things where you just need to be in tune with it. It doesn't mean that you're being treated inappropriately if someone offers it to you. It doesn't mean that they've missed something if they haven't offered it because you may not qualify for it. It's just to understand why that's going on. You should also be cautious not to just pop a statin at home either, like, oh, it's grandma's or grandpa's, I'm going to borrow theirs, like you would an aspirin.
And from a legal perspective, obviously, if you're reporting to an ER with an acute coronary syndrome diagnosis, there's obviously things that the emergency department should be doing very expeditiously to make sure you're triaged quickly and treated appropriately. Obviously, if there's any legal issues that come out of a setting like that, we at the firm handle those. You can find us on the web at zarzaurlaw.com or 855-HIRE-JOE. Thank you.